So under the Maternity and Infant Care Scheme, your baby is entitled to a health check 6 weeks after the birth. But don't forget, you're entitled to a checkup too. And this is usually done at the same visit. If your baby is very settled and asleep, when you get to the GP surgery, your GP will usually do your checkup first. At your 6-week postnatal checkup, your GP will talk to you for a few minutes. They'll talk to you about how the birth went, whether you had any complications during or after the birth, and what type of birth you had. They'll also talk to you about any symptoms you're having since the birth of your baby, and they might ask you if your bleeding has stopped. They'll talk to you about how you're feeding your baby, and if you're breastfeeding, they might ask you about how feeding is going. They will talk to you about whether you plan on having another baby soon or whether you want to talk to them about some contraception. They will also screen you for signs of postnatal depression. Postnatal depression is really common. About 1 in 4 or 1 in 5 women suffer from postnatal depression, so GPs will ask all women who come into them after having a baby. Your GP will also talk to you about when your last smear was, and if you're due a cervical smear, they'll advise you to have one about 3 months after the birth of your baby. The 6-week check for you is a great chance for you to talk to your GP about any worries you have about your own health, and never be too embarrassed to talk to them about any symptoms you have, even really personal symptoms like problems with your bowel or your bladder or pain having sex. Your GP has seen it all and heard it all before, so never be too embarrassed to tell them about problems like this. When you're talking to your GP about the experience of birth and being a new parent, it's quite common to feel a bit emotional, and quite a lot of women will cry or become a little bit tearful during this appointment, so don't worry if that happens to you. If you're worried, if you had a vaginal birth and you're worried that your stitches aren't healing, or if you're breastfeeding and you're worried that you might have a blocked duct, make sure and bring it to your GP's attention so that they'll know to examine you.